Good morning. Well, up and down the country, we know that schools have banned mobile phones from the school day, and we want to spread that good practice throughout the school system. So we're asking today a call for evidence on that issue to find out how best to implement that policy, but also other measures to ensure that we are doing everything in our school system to minimize low-level disruption in the classroom. Building on what we've achieved over the last 10 years, we've given more power to teachers and heads to keep control and discipline in the classroom, but we want to go further. We want to eliminate low-level disruption. We want to deal with the scourge of bullying in our schools. Children should be able to go to school feeling safe and content and able to work hard to secure a future for themselves. That's what we want to have in every school in the country, and that's what today is all about.
Do you have an idea, a model for what a child does when he arrives with his or her mobile phone at the class, or are you saying they can't even put it in their bag or their jacket on the route between between home and school?
Well, that's what the call for evidence is all about. There are some schools that require it to be stored in a locker when they arrive. There are other schools that trust the children not to take it out of their bags during the school day, and then, of course, it's confiscated if they do. So we'll look at all this evidence. What we do know, what I'm clear about, and have been for a long time, as is the Secretary of State, is that we don't want mobile phones out and distracting pupils during the school day, because they need to be focusing on their lessons. And also, we know that excess use of mobile phones, screen time, can affect children's mental health and their well-being.
So it may be that, would the government actually say that there would have to be lockers or shelves or whatever it might be, or will it be left to a school-by-school basis, Minister?
Well, that's what we're consulting on. And what we tend to do is to produce guidance to schools about how to implement a policy, and then it's for the school to implement. But in producing guidance, we need to go through a consultation process, and that's what's happening at the moment. We're looking at the evidence to see what is the most effective way to advise schools to implement what we do know is an effective way of improving children's attainment. And there are countries like France, for example, that banned mobile phones from schools 2 or 3 years ago, and other countries around the world have done the same.
The other thing you're looking at is mobile-free school days. I mean, schools already have very robust policies in place when it comes to the use of mobiles. They know what they're doing, don't they?
A number of schools, an increasing number of schools, are banning mobile phones from the school day, keeping them out of the classrooms. They are a distraction. There is evidence that they improve attainment, particularly children, less academic children do better if they're not distracted by mobile phones. Countries like France banned mobile phones from schools 2 or 3 years ago. And I've always been in favour of banning mobile phones from the classroom. They also can affect children's mental health and their well-being if they're continually spending too much time on the screen. In our curriculum on relationship and health education, we ask teachers to teach children the importance of rationing the use of mobile phones, so they are spending time outside with friends, doing their homework, talking to their parents, and not always glued to their mobile phones. So yes, we do want to ban mobile phones from the classroom, but we are today launching a call for evidence to see how best to implement such a policy, and also other measures we want to take to ensure that we eliminate low-level disruption in our classroom, get rid of bullying in our classrooms. We want children to have a happy, safe time at school. And building on the work we've conducted over the last 10 years to give teachers more power, more control over the classroom. This is going a step further now to make sure that every classroom is safe and a happy place.
As you know, the teachers' unions have said that they already do that, so they're not quite sure why you're saying that this morning.
Today, you're looking at a new regime being backed by the Education Secretary, your boss, Gavin Williamson, to make schools mobile phone-free zones. I'm stunned that every school isn't already banning mobile phones. Why not?
Well, a large number of schools, of course, are doing so. And it is proving to be an effective way of making sure children are not distracted by the phones. And of course, excess use of mobile phones can affect children's mental health and their well-being. So we're very keen on making sure that the practice of those schools that do ban mobile phones during the school day is spread across the system. And that's why today we are announcing a call for evidence on that issue, but also how we continue the drive to improve behaviour in our schools, both disruptive behaviour and low-level disruption in our schools. One child misbehaving in a classroom can affect that lesson for all the other children in that classroom. And we want to make sure that we have calm, ordered classrooms where children can work hard and study and do well without being bullied and without the fear or noise of the interruption of others. And that's what this call for evidence is about today.
I'm amazed.
Two other matters, Minister, on your brief. A lot of my listeners expressed concern when we tackled this yesterday that one child, unfortunately, testing positive in a certain school setting can, in some instances, lead to hundreds being told to go home. And I don't need to tell you that we're talking of millions of lost school days across certainly England. What action can be taken?
Well, of course, it is important that we identify children who have COVID and then identify their contacts and ask them to self-isolate. This is all part of measures across society to minimise the risk of transmission. We're conducting a trial in a number of secondary schools to see whether testing every day, daily contact testing, as an alternative to self-isolation, to see whether that is an effective alternative. That trial ends tomorrow, and we will look at the data to see if that can be an alternative. But it is important that to note that within schools that they've put in place measures to minimise the risk of transmission of the virus. There's extra ventilation, extra hygiene and hand washing, staggered lunch breaks, and so on, and keeping children in bubbles, to do everything we can to minimise the risk of transmission.
You don't think the current system needs to be changed then in any way?
Well, as I said, we've conducted the trial to see whether we can implement a different system to avoid having to self-isolate. But of course, we have to look to make sure that it is effective, and we'll take advice on that when the scientists look at all that data. But it is important that children continue to test themselves twice a week. That's also part of those measures, because again, 1 in 3 people with COVID have no symptoms. So we want to be able to identify any child who has COVID without symptoms, and that's what those twice weekly tests seek to do.
But when your colleague Sir Ian Duncan-Smith says the fact is most adults have either had 1 or 2 jabs, children themselves are more likely to get the flu than get COVID seriously, he's right, isn't he? Why should 350 children be sent home because one child has tested positive, surely?
Well, we don't want it to be 350 children. That's why those bubbles are carefully chosen.
Well, it is in some instances, I can assure you. That's what
yes,
we're hearing yesterday.
Not in most instances. I think the average...
but in some.
The average I've seen, I think, the data I've seen is about 30 will be in a bubble being sent home. And a lot of schools look at the seating plans as well for children to see who has been in contact with that person who has had COVID. But we have, as a society, to do everything we can to deal with this pandemic. This is a serious pandemic.
I think we've worked that out, Minister. I think we know
exactly. So we have to take these measures.
You will be aware that millions of lost school days are pretty serious too, of course, Minister.
It is, and education is a priority for the government. That's why we wanted schools to reopen in March, and it's why schools are the last to close and the first to open as we move through the roadmap to recovery. And it's a great achievement that as a country we've got 85% of our adults now having had at least 1 dose of the vaccine, and 60% have had 2 doses. We want, by having this short extension to July the 19th, it gives us an extra 4 weeks to ensure that more adults over the age of 18 have an opportunity to get the vaccine.
So tell us, are we going to get rid of these kids having to stay home if one person in the class tests positive?
Well, we have, as your reporter says, we are conducting trials of daily contact testing as a possible alternative to self-isolation. What matters also is that we keep the schools safe. And if you go around our schools, you will see a raft of measures to reduce the infection rates within schools. So there's extra hygiene, there's staggered breaks, we keep children in bubbles, and there's extra ventilation in classrooms to minimise the risk of transmission. There are about 3% of students who are self-isolating at the moment, and that's lower than it was in the autumn. And it tends to correlate with the number of infections in the community. But, children are testing at home twice a week. It's very important that families continue to test their children twice a week so we can identify children who do have COVID, and then they don't come into the school and spread that virus to other children.
So is that a yes?
No, we'll look at the results of the trial. And we'll make any decisions will be announced before we make a decision on step 4 going forward. But, we have to do everything we can to minimise the risk of transmission of this virus, and that's why all those measures have been taken within schools to keep children and staff safe.
So we'll know by the 19th of July?
Yes, we will. And we've also written to schools yesterday asking them to prepare for 2 tests to take place on the school premises as a way of preparing for that when we come back in September. What we're also concerned about is having more children in school. We want children to be in school. That's why schools opened on the 8th of March. It's why we prioritise education. So the schools will be last to close, first to open as we deal with this dreadful virus and this pandemic, because we do know that children are better for their well-being, for their health, for their education by being in schools. And again, that's why we have the twice weekly testing, and it's why we have all the raft of control measures within the school premises to minimise the risk of transmission of the virus.
We've seen some extraordinary statistics showing up to 250,000 pupils being forced to self-isolate at home, despite only 9,000 positive tests. I think those are on lateral flow tests and therefore, 60% incorrect. And so a tiny number of children, most of them not even ill, most of them not even having a symptom, testing positive for COVID, forcing out huge numbers of children to stay at home for 10 days, even if they're not ill at all. Lots of calls for that to end, including from the Children's Commissioner, Dame Rachel D'Souza. Is there going to be a new system in place for this autumn school term, which is not going to force whole year groups, whole classes, large tranches of schools to be forced out because one child tests positive?
Well, we do want children to be in school. That's why education is a priority. Schools were the last to close, the first to open as we deal with this dreadful pandemic and this virus. There are a whole raft of measures in schools to minimise the risk of transmission, the hygiene, the extra ventilation, the staggered breaks and so on, the bubbles, to try to do everything we can to minimise that risk of transmission and keep children and staff safe. We are conducting a trial at the moment of daily contact testing to see if that is an effective way of enabling those that have come into contact with somebody with COVID to avoid having to self-isolate.
So that would, instead of them having to self-isolate, they take a test, and if that's negative, they can go into school, and they just keep taking a test every day.
Yes, and we just want to, we're trialling that in a small number of schools to make sure that it is an effective alternative. And that trial ends, I think, tomorrow, and we'll look at the results of that. Well, you talk about the numbers of children self-isolating. It is about 3% at the moment, figures we announced recently, of pupils who are self-isolating because they've come into contact with somebody with COVID. It is important that those lateral flow tests keep taking place by children at home twice a week, so we can identify anybody who may not be showing symptoms but does have COVID, so that they don't go into school.
Except these tests that you're advocating, they are so unreliable that they have been withdrawn by the company that makes them, Innova, in America. They've been banned by the Food and Drug Administration in America. The Innova have actually said that anyone with these tests should destroy them or return them to the company because they're basically all but useless. Why on earth are we still using them for millions of pupils? Because
they're not useless. The lateral flow device tests high viral loads, and that's when you are at the most infectious, and you get the results within 30 minutes. If you do test positive, there's a requirement then to go on to take the laboratory-based test, the PCR test, to confirm that positive test. But they are extremely effective. And
why do we think they're extremely effective in this country and the Food and Drug Administration doesn't think they're effective in America?
Because
talk me through the science, capital T, capital S.
Our scientific advice is that testing using LFD tests that detect the virus when there are high viral loads, and you get the result instantly, are a very effective way of identifying people who don't show symptoms but are nevertheless carrying the virus. They
can miss a majority of positive cases, but they also get. I mean, they have false negatives and false positives on such a rate. I mean, you could just flip a coin and get similar results, couldn't you?
No. This is identifying many thousands of people who don't show symptoms, and as a consequence, they're not taking that virus into classrooms to spread the virus. It's a very effective way of identifying asymptomatic. 1 in 3 cases of COVID don't show any symptoms, and that's why it's important to to use this test to identify everybody we can.
Something else that you had said that pupils don't need from the 17th of May was masks in schools. And as a result, we've seen the number of kids that have tested positive going up and up and up. Will you look at that again come September? Will kids have to potentially wear masks when they go back to school?
Well, first of all, increasing numbers of children who are isolating, the 3% I mentioned earlier, is driven mainly by infection rates in the community. There's a correlation between the number of children who are asked to self-isolate because they've come into contact with somebody with COVID and the degree of infection in the community. We introduced face coverings for pupils in secondary school classrooms as a temporary measure. We reviewed that over Easter, and for May the 17th, it's no longer a recommendation. But of course, we do give discretion to directors of public health around the country, particularly in areas of high infection rates, to reintroduce or to maintain that recommendation in classrooms. And I think in about 60 local authorities in those high infection rates around the country, that there are recommendations to continue face coverings in classrooms. But it was a temporary measure. And as I said, the issue isn't about infections within the school. There are a huge raft of measures in place, so hygiene, ventilation, staggered breaks, and so on, to limit the risk of transmission in schools. This is about transmission in the community.
Will you be wearing a mask after the 19th of July, indoors?
Well, I wear a mask now when necessary, and
that's the law.
Yes, and I will. We'll see what is announced as we move to step 4.
Well, I spoke to several of your colleagues over the last couple of weeks, including George Eustace. He says he's not going to wear a mask after the 19th of July. And as you know, the Chancellor's also said the same. I just wondered what your view was.
My view is that I will adhere to whatever the guidance is that's announced leading up to step 4 of the roadmap.
So even if it's not a regulation that you need to wear a mask, you might still wear one?
I will wear whatever the recommendations are, the guidances to individuals about when and whether they should wear a face mask. We all have to do everything we can to minimise the risk of transmission, but you know, we want the roadmap to be a one-way journey. We want it to be irreversible, and we will look at the data. And I'm optimistic, the way things are looking at the moment, that the 19th of July will be the step 4 of the roadmap.
There was never any evidence looked at specifically about children wearing masks in classrooms. That was imposed without any new evidence being presented at all.
Well, we published the advice of Public Health England, of SAGE, when we make these decisions. All those sorts of decisions are based on the evidence of our scientific figure.
Yes, no, there was the evidence didn't advise masks, and there was no new evidence that was presented to suggest that masks were needed, and they were imposed on my child and my listeners' children for months on end. My daughter's school, they're still back in the classrooms as well. There was never any evidence presented that made any difference.
Is it 93,000 young people have failed to return to full-time education after schools reopened their doors? What are you going to do about that?
Well, this is an issue that's always worried us. That's about 30,000 more than you see in a normal non-pandemic year. These are vulnerable children. We want them in school. When the lockdown occurred in March, we took extra measures to get schools to talk to the parents of those disengaged children who were not coming into school. Schools remained open, of course, if you remember, for vulnerable children and the children of critical workers. Where we weren't seeing those families sending their children into school, the school would contact the families. We would work with our regional teams at local authority level to talk to those families via social workers and so on, to help do everything we can to encourage those children to come into school.
Perhaps extending the school day by half an hour. Is that going to happen from September?
Well, catch up, of course, is very important. Even as early as June last year, the Prime Minister announced £1 billion of funding for catch up, for money to schools to spend as they felt appropriate to help children to catch up. Also, the National Tutoring Programme was introduced back in June last year. And we've earlier in June, we announced another 1.4 billion, bringing the total together with a February announcement up to over £3 billion of catch up. And that includes money also to help for teachers to be the best that they can through extra CPD and training, because we know that the best catch-up, of course, Kay, happens every day in school with children at school in those classrooms. But we're also conducting a review right now of the evidence about extending the school day and time spent in school to understand how that would work, how effective it would be if we were to increase the length of the school day.
A couple of other matters. Researchers from University College in London said England and Northern Ireland should follow suit with Scotland and ban smacking. Do you agree?
I think these are matters for parents. I think the reasonable chastisement is allowed within the law, and I think it's important that parents are able to bring up their children as they see fit.
So a reasonable tap is permitted in your view?
Well, the law is very clear, and I think obviously parents have to behave reasonably and within the law. But I think I wouldn't go as far as the Scottish government has gone. You
wouldn't see yourself backing a ban on smacking?
No, I wouldn't.
Last couple of minutes together. Minister, it has to be said that your colleague, new Health Secretary Sajid Javid, struck a more optimistic or buoyant tone with his performance as first speech as the Health Secretary yesterday. Do you share his level of optimism?
I do, and as does the Prime Minister. We think things are looking good for July the 19th, step 4. We want the roadmap to be an irreversible journey, and that's why they extended the time between step 3 and step 4, just to make sure we have more time for more people to be vaccinated. But I am optimistic about July the 19th. We do want to get back to normal, but we also have to tackle this dreadful virus.
Finally, and I would imagine you've had sight of this, England's Chief Medical Officer, Professor Chris Whitty, was harassed in the street for the second time in a matter of months. A word or two on that behaviour, Minister.
Well, I've seen those appalling scenes in that video footage. Chris Whitty has been a first-class Chief Medical Officer throughout the pandemic, providing very high-quality advice to government, providing very calm advice to the public in those press conferences. Of course, that has made him a well-known figure, and that makes the behaviour of those yobbos just even worse. All of us should be able to walk through the park, walk in the street, free from that kind of harassment. And I know this is now subject to a police investigation. I hope the full weight of the law and the justice system will fall upon the culprits involved in that scene.
Well, hear to that. Do you think we need to give him some form of protection, and possibly JVT and other high-profile people who've worked in this field, Minister?
Well, that will be a matter for the security services and for Chris Whitty and JVT. But it shouldn't be necessary, Nick, should it really? No, for well-known figures to have security around them. We should all be able to walk down the street, however well-known people are, free from harassment. We live in a law-abiding, free society, and long may that continue. And that's why the police and the justice system do have to take very tough measures when these matters do occur.
Have you seen the video of Chris Whitty? I'm sure you have, being assaulted by some yobs last night. What do you think should happen to them? And do you think that he should have some form of protection? Because he obviously is dividing opinion. This is the videos we're talking to you. What do you think?
I think this scene is absolutely appalling, and I'm sure all your viewers and the general public will absolutely condemn the behaviour of these jobs. Chris Whitty has done a fantastic job throughout the pandemic in advising the government of the necessary measures to keep our NHS safe, to save lives, and he has been a very effective Chief Medical Officer during that period, and those scenes should not have happened. This is now a matter of police investigation, and I hope the whole weight of the law will come down on people that engage in that kind of behaviour. Should he be afforded some sort of close protection? Well, that is a matter for the security services and for Chris Whitty, but those scenes should never have occurred in our society. Absolutely wrong. People, whatever role they have in government, should be able to walk on the street, walk through the park, unaccosted by that kind of behaviour. It should not happen in a free, law-abiding society like ours.
OK, let me ask you about that video of Chris Whitty. He's been harassed in the street. The third time a video has emerged of Professor Chris Whitty, the Chief Medical Officer, being harassed in the street. 3 thugs, 2 grabbing him round the neck. I think they think they're being playful. They're not shouting abuse or that, but nevertheless, clearly assault, and clearly very, very frightening for Chris Whitty on his own. What do you make of that video and the attention that Chris Whitty has had?
Well, I think the scenes in the video are absolutely appalling, and I don't think there's a viewer of your listener to your program who would not condemn those scenes. Chris Whitty has done a magnificent job as Chief Medical Officer over the whole period of this pandemic in providing very good advice to government, keeping our NHS safe, saving lives, and we all owe him a great debt of gratitude. And the police are now investigating this appalling scene, and I hope that the full weight of the law will land on those culprits.
Have you ever used a private email account for government business?
All business that I conduct goes through my private office. The Information Commissioner is clear that any key actions and decisions are recorded, and that's why all government action that I conduct takes place through my private office. How I communicate with my private office is through a range of measures, including mostly paper through the red box system.
So you've never used a private email account to carry out government business?
Well, I will talk to my private office through a range of measures, phone, text, email, but government business is conducted via the private office so that there is a record of all key actions and decisions that are taken. All government action, all government business takes place through that office.
How surprised are you that other ministers are not as fastidious as you when it comes to carrying out government business?
Well, I think all ministers do conduct business through their private office. It's how
private email accounts, as you know, Mr. Gibb.
I'm sorry?
Talking about private email accounts, as you know, and as we know, at least two ministers in the Department of Health have used their private email accounts.
Well, that's a matter for the Department of Health and to be
I'm asking you what your opinion is.
Well, the rules are very clear that all government action needs to take place through private offices, through formal channels, so that a record can be kept of those key decisions. And when there are people do, of course, have private conversations, and the key thing is that those private conversations are communicated to the private office so that they can then be, if necessary, recorded as part of the decision-making process.
You saw Chris Bryant yesterday saying that Matt Hancock is the stupidest man on earth, snogging his mistress in front of a CCTV camera. It wasn't the smartest thing to do, was it?
Well, look, Matt Hancock has said that he breached the social distancing rules, and as a consequence, he felt that he had to resign, and that's what happened on Saturday. Matt Hancock has been, I think, a very good health secretary. He has managed this crisis, I think, this pandemic crisis, exemplarily, and we have kept the NHS safe. It hasn't been overwhelmed in that period, and we have one of the most successful vaccination rollouts in the world, with 85% of adults now having had at least one dose and 60% of adults having had 2 doses. So I would pay tribute to Matt. He took what he felt was the right decision to resign, and that decision was accepted by the Prime Minister.
He also employed his mistress at our expense.
Well, I'm a Education Minister. To be appointed a non-executive director, there is a process that's gone through with an appointment commissioner involved, and I'm sure that was the process that happened in the Department of Health, but I'm not close enough to all the details.
No, but she's his mistress, and we were paying her.
Well, what you want from a non-executive director is their expertise and experience, and that's what will have been sought in the Department of Health. But again, I'm not close enough to the process to know all the details.
Okay, but do we owe a debt of gratitude to the Health Secretary, Matt Hancock, as well?
I think we do. I think he has been a very good Health Secretary during this pandemic, indeed before. And if you think about what's been achieved, he has managed to ensure that the health service has been able to cope despite all the pressures on it. And we have one of the most successful vaccination rollouts in the world. 85% of adults have now had at least 1 dose, 60% have had 2 doses, and we hope that all people over 18 will have been offered a dose by the time we reach July the 19th. He admits himself that he made a mistake. He should not have breached the social distancing rules, and that's why he took the decision to resign on Saturday.
Oh, so he wasn't sacked. The Prime Minister seemed to imply yesterday that he was sacked.
Well, the story broke on Friday, and by Saturday we had a new health secretary. That's a very swift period of time between a story breaking and the resignation occurring. But it's clear that Matt Hancock took the decision to resign, and that decision was accepted by the Prime Minister.
Minister